I will just take one class, okay? I will take on first aid theory.
Yes, ma'am.
Okay, I'll take first aid theory.
Okay.
Okay. So the name of the unit is shock. 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 Write down. What is shock? Question you write down. What is shock? What is shock?
Shock.
SHOCK. Shock. What is shock? Answer you write down. Shock is a syndrome. Shock is a syndrome. SYNDROME. Shock is a syndrome. 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 Shock is a syndrome that results from a decrease. That results RESULTS. That results from a decrease in. That results from a decrease in. That results from a decrease in effective circulating blood volume. Results in a decrease. Results from a decrease in effective circulating blood volume. Effective circulating blood volume or fluid in the body. Or fluid in the body. Or fluid in the body. Fluid in the body as a result of injury or illness. As a result of injury or illness. As a result, RESULT. As a result of injury or illness. So there will be less proportion of blood volume. Okay, the circulation of blood volume will decrease. Okay, because of shock. Whenever there is shock, what will happen? There will be a decrease in the circulating blood volume or fluids. Okay, and because of which it may lead to injury or illness. Okay, full stop. Change the paragraph and write down. It can vary from. It can vary from. It can vary from. VARY vary. It can vary from. VARY vary from faintness to complete collapse. It can vary from faintness, FAINTNESS, faintness to complete collapse. COLLAPSE, collapse. Okay, so it can vary from faintness to complete collapse. Collapse means to fall down hard. Okay, next you write down effects of shock. Effects of shock. SHOCK. Effects of shock. 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 Effects of shock. Write down number one. Number one, early loss of consciousness. Early loss of consciousness. LOSS, loss of consciousness. CONSCIOUSNESS, early loss of consciousness that mainly involves the nervous system. that mainly involves the nervous system, and that may be fatal, F-A-T-A-L, and that may be fatal, F-A-T-A-L, fatal. Okay, so first effect is there will be a loss of consciousness. Okay, the person might become unconscious because he might faint or he might collapse. Okay, because of shock, because of the decrease amount of blood flow that is circulating in the body, it decreases. Okay, because of which the person feels nausea. Okay, and they even feel headache, and they might lose their consciousness, they might become unconscious. Okay, why? It is mainly because of the breakdown of the nervous system, and it can be sometimes fatal, means sometimes it may lead to death of the person. Okay, so number 2 you write down, progressive loss of blood from progressive, P-R-O-G-R-E-S-S-I-V-E, progressive loss of blood from active circulation, progressive loss of blood from active circulation, progressive loss of blood, progressive loss of blood from active circulation,
Ma'am.
yes, progressive loss of blood from active circulation, comma, which may lead to failing heart output, which may lead, L-E-A-D, lead to failing, F-A-I-L-I-N-G, which may lead to failing heart output, and insufficient oxygen,
Failing, ma'am.
huh?
Ma'am, failing.
Heart
Failing.
output,
है?
failing heart, H-E-A-R-T,
Hard.
heart output, O-U-T-P-U-T,
Yes, ma'am.
failing heart output and insufficient oxygen, insufficient oxygen to cells that are vital for survival. To cells, C-double-L-S, to cells that are vital for survival. Okay, the third point you write down, sustained lowered blood pressure, means there might be a fall in the blood pressure. Okay, the blood pressure might decrease. So sustained lowered, L-O-W-E-R-E-D, sustained lowered blood pressure, BP, which may lead to liver and kidney failure, which may lead to liver and kidney failure, Okay, there will be a decreased amount of blood pressure. Okay, your blood pressure will go down, because of which you might feel fainting. Okay, the feeling of faintness, then there might be collapse. Okay, then loss of blood from active circulation. Because of all these things, your blood pressure decreases, and which may also lead to your liver and kidney failure ultimately. Okay, and sometimes it may lead to, sometimes the cause might be fatal. Fatal means it might lead to death of the patient. Next, you write down causes of shock. Write down the causes, C-A-U-S-E-S, causes of shock. Causes of shock. Causes of shock. Number 1, severe or extensive injuries. Severe or extensive injuries. Severe or extensive injuries. Severe or extensive injuries. INJURIES, injuries. Severe or extensive injuries. Number 2, severe pain. Severe pain. Number 2 is severe pain. SEVERE. Severe pain. PIN, pain. Comma, heart attack. Severe pain, comma, heart attack. HEART, heart attack. ATTACK, heart attack. Number 3, loss of blood. Number 3 is loss of blood. LOSS, loss of blood. Number 4 is severe burns. Number 4 is severe burns. BURNS, burns. Severe burns. Number 5, electric shock. Number 5, electric shock. Number 6, exposure to extreme heat and cold. Exposure to extreme heat and cold. COLD, cold. Number 7, allergic reactions. Number 7, allergic reactions. Allergic reactions. Number 8, gas poisoning. Number 8, gas poisoning. Gas means what? Gas, noxious gas, okay? The harmful gas. Gas poisoning. Then number 9, bites or stings of poisonous snakes or insects. Bites or stings. STINGS. Bites or stings of poisonous snakes. SNAKES. Snakes or insects. INSECTS. Insects.
Poisonous snake and
or insects. Number 10, poisons taken internally. Poisons taken internally. Poisons taken internally. Taken internally means consumption of poison, okay? If somebody consumes poison. Then number 11, emotional stress. Number 11, emotional stress, STRESS. Emotional stress, comma, fright, FRIGHT, fright. Emotional stress, comma, fright, FRIGHT, fright. The last, number 12, certain illness. Number 12 is certain illness. ILLNESS. Certain illness. Then you write down certain illness. Okay. Then you write next point you write progress of shock. Underline it. Progress of shock. PROGRESS. Progress of shock. SHOCK. Underline it. Progress of shock. Underline it. Then you write number 1. Number 1. Blood flow is the entire. Blood flow in the entire. Blood flow in the entire body is disrupted. Blood flow in the entire body is disrupted. Blood flow in the entire body is disrupted. DISRUPTED, disrupted. Number 2nd point, blood flow to heart is decreased. Blood flow to heart is decreased. Blood flow to heart is decreased so that below you write number A, So that number A, below you write number A, heartbeats grows faster. Heartbeats grow faster, F-A-S-T-E-R, faster. Heartbeats grow faster. Number B, write down. Blood vessels near the skin and in the arms. Blood vessels near the skin. Blood vessels near the skin, S-K-I-N, skin, and in the arms. And in the arms, A-R-M-S, arms. And legs, arms and legs, L-E-G-S, legs. Constrict, C-O-N-S-T-R-I-C-T, constrict. Constrict, comma. Sending most of the available blood supply. Sending, S-E-N-D-I-N-G, sending most of the available blood supply. Sending most of the available blood supply to the vital organs of the body. To the vital organs of the body, B-O-D-Y. To the vital organs of the body. And to the nerve centers of the brain. And to the nerve centers of the brain, B-R-A-I-N, brain. So the second point that you have written, blood flow to heart is decreased. Why it is decreased? Okay, the first point is because heartbeat grows faster. Your heartbeat grows faster. What is the normal pulse rate? Anyone? What is the normal pulse rate? Simon Debarma. Okay, blood flow to the heart is decreased. Okay, your blood pressure decreases because the heartbeat grows faster. First point. Number A point, and number B is because the blood vessels near the skin. Okay, the blood vessels that are present in your skin, the small capillaries that are present in your skin, arms and legs, it constricts with each other. Okay? Because of which the available blood supply to the vital organs, okay, it sends more of the blood supply to the vital organs. Okay, because of which the heartbeats grows faster. The vital organs, what are the vital organs of our body? Like the heart, lungs, kidneys, livers, all these are our vital organs. Okay, so most of the available blood supply is sent to these vital organs. Number 3, you write down, blood goes to the brain and other vital organs so that, number 3rd point, blood goes to the brain and other vital organs. Blood goes to the brain and other vital organs so that body cells do not receive, R-E-C-E-I-V, receive, do not receive.
Ma'am, repeat another vital organ.
Blood goes to the brain and other vital organs. What are the vital organs? Vital organs are your heart, lungs, kidneys, liver, spleen, all these are your vital organs, okay? So blood goes to the brain and other vital organs so that body cells do not receive, enough blood, B-L-O-O-D, blood, and therefore do not get enough oxygen or nutrients. N-U-T-R-I-E-N-T-S, nutrients. Number 4, you write down, blood vessels.
Therefore do not.
What?
Therefore do not
get enough oxygen or nutrients. Number 4, you write down, blood vessels, comma, blood vessels, comma, like the rest of the body suffer from blood vessels, like the rest of the body, blood vessels, comma, like the rest of the body suffer from this lack of oxygen, suffer from this lack of oxygen, suffer from this lack of oxygen, and they lose their ability to constrict. And they lose their ability to constrict. C-O-N-S-T-R-I-C-T, constrict.
Ma'am, can hear your voice.
Ma'am, lack of oxygen and?
Lack of oxygen, and they lose their ability to constrict. And they lose their ability to constrict. C-O-N-S-T-R-I-C-T, constrict. And they lose their ability to constrict. Full stop. So that vital organs and the brain, so that vital organs and the brain, so that vital organs and the brain do not receive so that the vital organs and the brain do not receive enough blood and shock worsens. Do not receive enough blood, PLOOD blood, and shock worsens. W-O-R-S-E-N-S. Worsens means it will lead to death of the person. It can lead to death of the person. Okay. And shock worsens. W-O-R-S-E-N-S. Full stop. Number 5, you write down. As the blood supply is shut off, as the blood supply is shut off, S-H-U-T, shut off, O-F-F off, to the internal organs, as the blood supply is shut off to the internal organs and to the brain, the cells begin to die. And to the brain, the cells begin to die because of oxygen deprivation. Because of oxygen deprivation. That is obvious. Okay, if there is no blood supply to your body, okay, if there is less amount of blood supply to your body, what will happen? What will happen ultimately? The cells, okay, it will begin to die. Because of what? Because of lack of oxygen to the cells and tissues. It will automatically die. Okay, because of which the person will, the ultimate factor will be death of the person. Because there is less amount of oxygen, less amount of blood to pump. Okay, it becomes narrow, it constricts. Okay. The last point you write down, if shock is not reversed, comma, if shock is not reversed, R-E-V-E-R-S-E-D, if shock is not reversed, comma, the internal organs and brain eventually die. The internal organs and brain eventually die. D-I-E, die. The internal organs and brain eventually die. D-I-E, die. Next you write, factors influencing the degree of shock. Factors influencing the degree of shock. S-H-O-C-K. Factors influencing the degree of shock. Underline it. Underline it and write number 1, pain. P-A-I-N, pain. P-A-I-N, pain. Put a dash and write down. It increases the severity of shock. So it is pain. Okay, big is also one factor. Okay, which increases the severity of shock. S-H-O-C-K. Pain. Number 2, you write physical condition. Number 2 is your physical condition. P-H-Y-S-I-C-A-L. Physical condition. Put a dash and write people who are starved. People who are starved. S-T-A-R-V-E-D. People who are starved or exposed to extremes of cold or heat, H-E-A-T, heat, go into shock easily. Go into shock easily. Okay. Especially Dukhya Manubur, okay. All those people who are not able to get their meal properly, okay, who are not getting to eat properly, and those who are exposed to extreme cold and heat without proper nutrition, these people are more prone to get shock. Okay. Number 3, you write fatigue. Fatigue, F-A-T-I-G-U-E, fatigue. Fatigue, put a dash and write, it increases severity of shock. It increases severity of shock. Fatigue, it increases severity of shock. It increases severity of shock. Number 5, individual reaction. Oh, sorry, number 4, na? Number 4, you write disease. After fatigue, write down disease. Number 4 point is disease. D-I-S-E-A-S-E, disease. Put a dash and write down. People having chronic disease develop shock easily.
People having
chronic disease, C-H-R-O-N-I-C. People having chronic disease develop shock easily. Chronic diseases are what? Like your cancer, okay, diabetes, heart disease, lung disease, kidney diseases, all this comes under your chronic disease. Okay, so all these people who are suffering from heart disease or cancer, okay, diabetes, lung disease, kidney diseases, so all these people, they are more prone to develop shock. Okay, last point you write individual reaction. The last point you write number 5. Oh, sorry, not the last point. We have 6 points. Number 5, you write individual reaction. Put a dash and write down. Shock varies from person to person. Shock varies from person to person. Why person to person? Because it depends on the nutrition. It depends on proper immunization. Okay, and strength of individuals are different. Some people, they might look lean and thin, but they might be strong. Some people look fat and huge, but they are not strong. So it depends from person to person or individual to individual. Last point, likha, 6th number. Improper evaluation. Write down the last point, number 6. Improper evaluation. Sorry. Improper evaluation, E-V-A-L-U-A-T-I-O-N, evaluation, comma, care, C-A-R-E, care, C-A-R-E, care, comma, movement, M-O-V-E-M-E-N-T-S, movements, M-O-V-E-M-E-N-T-S, movements. Put a dash and write down. Shock may be increased by rough handling, rough, R-O-U-G-H, rough handling, H-A-N-D-L-I-N-G, rough handling, and by delay in treatment, T-R-E-A-T-M-E-N-T. Okay, and by delay in treatment. So see, there are types of shock. Okay, there is one whole so for today I will take till here. There are some more things, but I will take it in the next class. Okay, and you please give me your attendance. Okay, A and B. Anya is present. Anya is present or not? Absent. Saurabh is present from section A. Absent. Okay, Roop, you write down and give it to me, okay, for section A.
Okay, ma'am.
Okay, you please write down and give it to me. And Srijana, you please write down for section B.
Okay, ma'am.
Okay, thank you so much. You can join your class for anatomy.
Thank you, ma'am.
Thank you, ma'am.
Okay.
Thank you, ma'am.
Ma'am.
You can leave the class.
Thank you, ma'am.
Okay.